My PowerPoint is over congestive heart failure. Congestive heart failure occurs when the heart does not pump blood like it should. Congestive heart failure can be chronic, or you can have an acute exacerbation. This is a picture of some signs and symptoms. With congestive heart failure, most of the time you have an enlarged heart, which causes swelling and can cause fluid in the lungs. CHF can occur after certain conditions have weakened your heart over time. It can also occur if your heart has stiffened over time. Both of these affect how well the ventricles pump blood. CHF signs and symptoms can include shortness of breath on exertion, fatigue and weakness, edema in your legs and feet, rapid or irregular heartbeat, swelling of the abdomen, also called ascites, rapid weight gain because of fluid overload, and increased need to urinate at night. Some causes of congestive heart failure include coronary artery disease and heart attack. Coronary artery disease is the most common cause of heart failure. It results from the deposits of plaque in your arteries, which makes it harder for your heart to pump blood, leading to a heart attack. Another cause is hypertension or high blood pressure, which can cause the arteries to stiffen. Heart muscle damage or cardiomyopathy. Also myocarditis, which is the inflammation of the heart muscle, which is often caused by a virus. Congenital heart defects can also lead to heart failure. And heart arrhythmias that cause your heart to beat too fast or too slow. And chronic diseases such as diabetes can also cause heart failure. There are many risk factors that contribute to CHF. Having more than one risk factor increases your chances of developing CHF. Some common risk factors include high blood pressure, coronary artery disease, heart attack, diabetes medications such as Actos and Avandia. Certain medications are known to increase your risk for congestive heart failure. Sleep apnea, congenital heart defects, valvular heart disease, alcohol use, tobacco use, obesity, and irregular heartbeats. There are 4 different types of heart failure: left-sided heart failure, right-sided heart failure, systolic heart failure, and diastolic heart failure. Left-sided heart failure causes fluid to back up into your lungs, which causes shortness of breath and abnormal lung sounds. Right-sided heart failure is characterized by generalized edema or swelling. Your legs, feet, and abdomen may become swollen with fluid. You may notice pitting edema or swelling that when you press down causes indentation. Then systolic heart failure is caused by problems with the left ventricle. It doesn't contract like it should. Then diastolic heart failure is caused when the left ventricle cannot relax or fill fully. Many of the risk factors for congestive heart failure can be prevented by making changes to your lifestyle. You should not smoke or quit if you do smoke. You should get regular exercise. Lose weight if you're overweight or obese, as this puts more work on the heart. Maintaining your diabetes or high blood pressure, and reducing stress. These are my resources.